My name is Brett Picciotti, and I work for Kennedy Health Alliance. I'm a neuromusculoskeletal medicine physician, and today you're going to see me demonstrate some osteopathic manipulative treatment techniques on a pregnant patient that has ongoing back and pelvic pain. So in this technique, we are treating the right side of the rib cage because she had some rib pain in this area, and we are using posture and positioning to balance the ribs and try to put it back into place because it was slightly posterior from the pregnancy. Here we're treating her lumbosacral area, again using a balancing or ligamentous type of technique and trying to relieve pressure associated with the pregnancy in this area. Here we're treating the rib again that was looked at previously, but using a different technique and also allowing the patient to be more comfortable laying on her back and using gravity as a guide to help pull the rib back into place. Here we're treating the patient's diaphragm in a technique called doming of the diaphragm, allowing her better breathing and removing some of the restrictions that can occur within the diaphragm apparatus during pregnancy. In this technique, we are treating the patient's pelvis on the left side, including her sacroiliac joint and the lower part of her lumbar area by balancing through using movement of the leg and the hip to do so. Here we're treating the patient's foot and ankle at the same time. We are removing restrictions in this area and also some buildup of fluid, which occurs commonly in the lower extremities during pregnancy. And this transitions into a technique that is used for some hip capsule restrictions and compression on the right side, as well as within the right ankle. Here we're treating the patient's lower back again and pelvis on the left side, using the part of the leg bone to balance through to some ligamentous structures in the back and also the sacroiliac joint on the left side. Here we are doing a partial distraction of that area to open up the SI joint. This is a technique that is used to treat a muscle within the pelvis called the Psoas muscle. This is a counter-strain technique for a tender point in this area. When that muscle is strained or stretched, we hold this position typically for 90 seconds until the pain is alleviated at that point. This technique is treating the pubic symphysis area. In this particular patient, she had some issues with this in her pregnancy, so we were working on that during successive visits. And here we are stretching out the left hip, and we will do the same thing on the right side for symmetry. This is a soft tissue technique that works on the paraspinal musculature or the lower back muscles next to the spine. We loosen those up near the end of the treatment process so that she does not get any soreness or stiffness afterwards.